Hey guys, I am back. I've been reading over this letter and I decided pagepopie.com if you want to catch up. The letter is that I got from St. Joseph's Health is directly like responding to this website. So, and they've read the blog and they've listened to all the videos that I posted on my YouTube, and which are posted and linked to that page. So I'm going to read it because as I was reading it, and it started out okay, but the more I got into it, I was like, okay, this is ridiculous. And I just want to read it out loud because it's ridiculous. And I don't have a cold. I don't have anything, but my nose is itching. So I want to scratch it, but I want to do it with a Kleenex because I'm trying to follow, all of the rules of what we have going on here in America. Okay, so this letter is addressed to me, and it is directly responding to a complaint that I sent to them regarding my mother stay there in this past September when she went in for surgery, and I mean, just things went downhill. But in our stay there, we ended up with C.diff and other infections, that they couldn't treat because she had C.diff, and C.diff requires zincomycin, and you have to take it for 2 months. And if you give antibiotics for other things, it makes the C.diff worse. So they knew. They gave it to her, and it's in one of the videos that proves that they knew. They were covering it. They have this stuff called M9. I have a bottle of it here because it gets rid of the smell of poop. And when you have C. diff and you have a bowel movement, it smells, and it doesn't smell great. So they were spraying it everywhere, and they were giggling, and they were having a good old time spreading C. diff, and then transferred her with it. And we didn't find out she had it till 3 days later. I didn't know until I read, as me going over the 300 pages of medical records that I have to look through, which is nothing. It's a drop in the bucket. That right there led me to, I've got to complain. So I complained. I don't care. I'm going to complain. Because I could tell that they were, so listen to this letter. I'm going to start from the beginning because I've already done a few videos and I've kind of ranted because I was angry, and I just want to read. I'm just going to read like I'm reading. So here we go. Are we ready? Listen. And I'll talk about it later. I'll get as far as I can until I just can't anymore. Because some of this you can go back and I'll tell you when like I actually stopped talking of it in previous videos. So, all right. So this was written to me on February 10th of 2020. By a Mr. Kia Parsi, MD, at Chief Medical Officer at CHI St. Joseph's Health. I don't know him. I never met him. I just know that I complained, and this is the letter, and it says, "Dear Ms. Keaton, providing quality and compassionate care is the ultimate goal of St. Joseph's Health College Station Hospital. Please accept our apology that you were less than satisfied regarding your mother, Linda Keaton's September 2019 hospital stay. We are appreciative that your concerns were brought to our attention via your January 16th, 2020 Ethics Point online system submission. I would also like to apologize for the time it took to respond to your complaint. The concerns you have voiced required a thorough and detailed review of the entirety of care provided to your mother during her hospital stay. It is clear from your communications related to your mother's recent hospitalization that you care deeply about her health and well-being. Like you, I have elderly parents. Helping them navigate through the healthcare system with developing healthcare issues as they age can at times feel overwhelming for all family members. It is my understanding that after her hospitalization, she was transferred to a rehabilitation facility and is now home. I hope she continues to recover and improve. The information you referred was reviewed. Review was coordinated independently by an experienced healthcare manager who is not involved in direct patient care. The review process included examination of the materials you provided, review of the record of care, interviews involved staff members, and assessment of both policy and current literature. Findings were reviewed with appropriate clinicians who did not participate in your mother's care. Conclusions are communicated to executive leadership and represent the hospital's finalized determination. The information below is provided in response to your ethics point submission, as well as communication you have given on social media. Given the nature of the materials provided for consideration, the review is a best effort to discern your most significant concerns. Please accept our apology that this discussion is long. There were a lot of questions and observations you offered for our consideration. Response to some of these concerns benefit from instructive explanation rather than simple response. Should there be a significant issue that you feel was not addressed, please let me know so we can determine if further review is warranted. Leadership appreciates every opportunity to improve our services and provide the quality of care our patients and families expect and deserve. We understand your concerns to be the following. That is page 1. Let me go over this quick. Concern. On the day of surgery, you were notified by your mother's surgeon that her surgery went well and she should be out of surgery in about 45 minutes. You were alarmed when this estimate was prolonged. Finding. Concern substantiated. Please accept our apology that this communication was imprecise. 45 minutes would be within the parameters for transfer from surgery to post-op. So 45 minutes from surgery to post-op. In PACU, they just put you in the hallway, I guess. In PACU, patients are very closely monitored to ensure that they are sufficiently recovered from anesthetics and can be safely cared for in the general surgical unit. This time frame can change due to a patient's pre-existing medical conditions, age, response to anesthesia, and vital signs. Your mother's stay was longer than the expected 45 minutes reported to you by the surgeon. Unfortunately, the PACU staff was not made aware of the time expectation you were told, and thus unaware of the need to clarify this with you. The involved surgeon will be informed about your feedback so that communication can be improved. Concern. Multiple questions relating to the use of Narcan. Your mother was a hard wake, and that's in parentheses. Narcan was administered inappropriately by the anesthesiologist and not documented. Narcan caused the Takotsubo, which you spelled wrong throughout all of the pages, syndrome experienced by your mother. Findings partially substantiated. Upon arrival to PACU, hold on a second, I want to see something. No, sorry. I'm making sure. Upon arrival to PACU, there was an episode where your mother's oxygen saturation dropped due to breathing difficulty. Staff took immediate action to maintain her airway and assure proper oxygenation. Anesthesia was in the clinical area, and a certified nurse and an anesthesiology provider responded to her bedside. It is documented that a single dose of Narcan was administered by his order to partially reverse the effect of her anesthetic. This action corrected the temporary concern, and her recovery proceeded normally without further incident. The Narcan administered was a normal dose. Literature suggests that for partial reversal of anesthesia in elderly patients, use of a smaller and sequential dose may be considered. The decision regarding the dose use falls within the provider's discretion. A treating provider must determine the safest and most effective course of action based upon their training, experience, and patient condition. Inappropriate use was not substantiated. Narcan can be a life-saving drug for patients that have depressed respiratory efforts from certain anesthesia-related medications. Takotsubo, which is Takotsubo, if you're actually looking for it, it's a B and not an M, was first identified in 1990, and thus, which is not, it was named in 1990. It was identified and it was happening way earlier than that in the 70s. You can find stuff in the 70s, doctors' journals. They just named it. Okay. It says Takotsubo was first identified in 1990 and thus is a relatively new clinical presentation. It is considered as a rare condition. TCM is most commonly associated with acute physical or emotional stress, such as major surgery, and earned the unfortunate name broken heart syndrome. The syndrome is more common in elderly women. 90% of cases are women with a mean of age of 70 years. As you observed, TCM can unpredictably occur after acute withdrawal of opioid use, chronic opioid use. Literature supports that TCM's cause is more likely due to multiple factors, with a single mechanism not enough to explain its occurrence. Given these facts, while it theoretically possible that Narcan administration might have played some role in your mother's development of TCM, there is no way to confirm this considering her other multiple risk factors. The benefit of preserving your mother's breathing greatly outweighed the risk of development of a rare medical condition. So you didn't, I'm going to keep reading because I got further and it was, you can still watch videos back of that previous video. So I'm going to keep going. Your mother was not placed into her room immediately upon return to the general surgical floor. That's when I found her in the hallway, right? And they were in the room. And this is so irrelevant. It's not what my complaint was. Finding substantiated with comment. As you pointed out, you went to your mother's room to await her return from surgery and had placed several of your personal belongings there. Patients are brought to the floor by the PACU team. They would not be aware that you had been in the room. Upon arrival, they noted belongings in the room with no one present and appropriately sought to confirm with floor staff that your mother's room assignment had not been changed. What does that have to do with anything? I don't understand where you picked that out as a concern. It wasn't a concern. It was part of the story I was telling. It was a fact. Concern. Surgery was to be an outpatient procedure with a one-night stay, and this whole finding was about a video that you can watch of, I think it's Dr. LeShin, because I don't know, it's just of their audio, but I'm pretty sure it's when Dr. LeShin and his PA came into the room, and I was asking, why are you guys telling my mother to go home every day? Not just them, but every nurse that walked in the room was treating her as if her shoulder surgery outpatient thing was still in effect and that they wanted her to leave. And I was like, there's no way that she's leaving right now. We have too many issues in place. Something bad has really happened and I can't care for her at home. So until I found out more, and you can listen to the videos, I say these exact words, and this is the response I'm getting from them. Go to pagepopeye.com and you too can catch up, because I am just hacked off that this was the response that I got. So, the concern. Surgery was to be an outpatient procedure with a one-night stay. Finding. Let me take a drink. Okay. Finding. Healthcare has become very confusing. No, oh wait. Finding. Substantiated with comment. Healthcare has become very confusing. Due to regulatory rules, an inpatient stay needs to meet certain objective standards, which includes a rule for a 2 midnight stay before care is considered as an inpatient event. Without complication, it was anticipated your mother would be discharged prior to meeting inpatient status, which was not an issue. During her preoperative care, 3 informed consent discussions were documented, which outlined potential risks benefits and alternatives to her planned surgery. Your mother's surgeon documented that prior to surgery, evaluations were performed to ensure that she was healthy enough to have surgery. Unfortunately, she did experience some of the potential complications discussed that required appropriate treatment before she was ready to discharge. There was concern expressed regarding your mother's inability to urinate after surgery. This is not unusual after receiving anesthesia. Post surgical urinary status is always monitored by nursing and the provider. Nurses will contact the attending physician according to their professional assessment and policy. In this instance, they called in to response to your repeated request rather than accordance with their normal practice. There was no identified concern regarding this matter. There was another concern relating to an unopened. Okay, wait, let me stop. Okay, because they're moving on to this unopened, this IV saline bag, and I want to talk about this. What they're talking to and they're referring to in this is as if my mom didn't have the code blue at their hospital because she had a flash pulmonary edema at her time of discharge, which took her to the ICU and resulted in them finding out the next day that she had suffered from broken heart syndrome, which is Takotsubo syndrome, aka cardiomyopathy, cardioinfarction. There's all kind of little names for it. It's been around more than 1990. They're not studying it for a reason. So they're talking about me complaining about, I don't know what this is. The concern with surgery was to be an outpatient procedure with a one-night stay. I think I said that once in my blog, and they picked that up as a complaint. And I am sitting here saying that is not a complaint. That was, but now that you bring it up, it was something that in one of my videos, you can listen to me to asking one of the nurses, hey, why does everybody keep asking my mom to go home? She's no shape to do that. Like, this bad stuff has just happened. Like, we're no longer a shoulder surgery, right? They know that, right? They know we're not a shoulder patient anymore, but I don't think they knew that. Oh, well, I don't care. This is going to be called out because I think the upper staff knew what went on with her, but the lower staff didn't. So each nurse that came in there every day running their rounds through that little floor didn't know what was going on. And they treated my mama like she was about to leave for the day, every single day. And we were there for 7 days for an outpatient overnight procedure. And this is your response to my 7-day stay at your facility. And let's go in, let's talk about the cath. When my mother went into the hospital, she never, ever had a cath. Never. It wasn't part of her life. She's not even incontinent. She's 76 years old. She has full control of her bladder. So when we went in, it was an outpatient surgery. They should have pulled it, I'm assuming, and had her up right away because it wasn't her legs. Like, we needed PT to get her up to the bathroom, even if it was a bedside commode. I didn't care. But no, they didn't for 7 days, by the way. But we're talking about the cath. They also pulled the cath, put the cath, pulled the cath, put the cath. Oh, pull the cath, put. What? Well, we need her to be, and then they put a diaper on her. Well, my mom doesn't wear a diaper. Oh, it's okay. She can wear a diaper now. No, she can't. We came in a certain way, and until y'all are ready to address the fact that something bad happened that caused her now to be in a freaking diaper, there's a problem. Well, there starts your infection. You got the cath. You got the diaper. You got the in no bedside turning, no, really, people didn't want to get into all that. You can read that in the medical records where she pooped and it fell all over the floor while she was doing PT, and it was on her socks and got on the bedding, and PT bailed and gave it to the nurses who, when the nurses, I was out of the room because I tried to give them privacy during that time because I figured it gives me also a break to get out of the room. When I saw somebody in there, and I thought, well, she needs to learn this on her own because I was naive. Well, this happened, and I'm reading it, but you can read it in the medical records. And she, at that time, it was 2 days before we were dismissed. The smell became the cover up. They have these bottles of M9 and they squirted everywhere and they were covering it up and whisking it away. But there were also times that my mom was pooping and they told her just to stay in her diaper for a while in case she needed to go some more. So she was laying in it for like 30 minutes to see if she needed to poop some more. This is a woman who just had Takotsubo syndrome and a flash cardiomyopathy. Not to mention, she had just gotten removed from a surgery days before where they had done a total reverse replacement on her shoulder, on her right shoulder, which it was like this balancing act between these doctors where they couldn't figure out what they were treating so much that they didn't treat anything. And we laid there and doctors were scared to talk about this. And then the shoulder was just strapped to her side because she was suffering so much heart arrhythmias through days and days of heart arrhythmia in this progressive care unit at St. Joseph's Hospital, which was shut down completely for renovations at the time. It's ridiculous that they left us there. It's ridiculous. It's ridiculous that I didn't think about it till 5 days in. And you can listen to the video on my website at paigepie.com as well, of me asking Dr. Obi, the nephrologist, that should we get moved somewhere else because it seems as if she's not getting much better. And he gets defensive. He says, "What? Who, you signed a release." That's what you're saying here too, right? Everybody signs these releases. But we also have a right to good care when something goes wrong. And so when something went wrong and it ended up being your fault instead of her fault, y'all spent the entire time covering your own tails. And I was just sat amazed, and I couldn't break away from my mother at the time too far, because if I left the room, y'all went in the room. And when I came back in the room, my mom would say, "Well, the doctor was in the room." Really? What did the doctor say? Well, my mom loves doctors. So she's like, "Oh, she's a 1950s girl. She loved her baby's doctors and all that stuff, And these doctors would wait. They would sit at the stations and wait till I left the room and go into her room. Oh, and this happened multiple times. I'm only lucky to have the videos I have of audio recordings of the ones I did, because one of them you can see I physically ran to the room because my sister texts me and says they're in here, and he had already started blah, 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 talking nonstop as fast as he could, trying to explain it away. And so I got him into a 15-minute conversation, and you can listen to it on my YouTube channel. I'm not sure which one it is. I wish I could link you to it. I'll link to it in the comments and kind of lean to each one. If not, just go through them. They're interesting. It's interesting because of healthcare, and it's interesting because I'm sure we're not the only. In fact, I know that we're not the only ones, because I already have people contacting me. that have been in your College Station location that I found on your College Station location's Facebook page when I shared my woes with them about it. And they've sent me pictures and their stories, and it's just disgusting. It's like, and it validates my concern here. So here I go. And I'm looking at, you're trying to send my mom home in a diaper with a catheter, which she never had prior to this ever. But you won't tell us why. In fact, people pee through catheters. What is happening? Let's read that again now that I've explained to you that my mother was never, ever, ever incontinent, nor did she ever, ever wear any kind of diaper or anything like that. So it says, oh my, where's your sentence? Oh, there was a concern expressed regarding your mother's inability to urinate after surgery. Okay, which is 7 days, guys. 7 days she was there. 7 days. My nose is itching. This is not unusual after receiving anesthesia. Post surgical urinary status is always monitored by nursing and the provider. Nurses will contact the attending physician according to their professional assessment and policy. In this instance, they called in response to your repeated request rather than in accordance with their normal practice. There was no identified concern regarding this matter. Okay, and let's go into there was no I did my mother was not drinking because she couldn't use her arms and she was constantly nauseated. So if you look through the medical records, she's given this nausea medicine just constantly the whole time. I mean, just bam, just covered every masked every symptom you could have imagined her having. I can't even remember the name of it, but I'll figure it out. And you can read it because I posted it on my website. So she was given this. And so as I would try to feed her and try to give her something, it was little amounts. Like we were getting little water and she didn't have an IV bag placed. She didn't have an IV bag placed at all after she got back from ICU. And that was 5 days before we left. So five days passed and they started to bring her, meatloaf and gravy and mashed potatoes and just not even like she'd had a heart thing happen on the 6th. Like I was eating her food because I was just like, she's not going to eat this. She can't use her arm at all. She's in severe pain because the nerve block is gone and she can't take any opiates anymore because they've given her this Narcan and she had this super reversal, like withdrawal symptom thing, which ended up with she can't take any of the hydrocodone that she actually needed at the time, just because of the shoulder in general. But no, she couldn't have it, so she didn't. And so here we are, and she's got this cath. They want to send her home with it. Well, we don't even know what that means and aren't willing to just go with the flow on that without them telling us more, and they weren't willing to. So and then here's another. That was that. Okay. At one point, my mother's urine coming through the catheter was as thick as mayonnaise. So my response in this instance, they called in response to your repeated request. That's right. Because when I squeezed her catheter tube, because I was like, what is this? And I squeezed it. I was like, it's white, creamy, thick, all the way, the whole to the bag, to where I had to go to the front office, talk to them. Everybody at the nurses station can testify to it because they all whipped their heads around when I said it was as thick as mayonnaise. And the nurse said, well. I said, well, we need somebody to come look at it. Well, when they came to look at it, they'd already realized she had C.diff by this time. We were at another place. When this place is saying there was nothing wrong, on the next place, she had so much infection going on that they didn't know what to do. In fact, they spent 17 days with my mother in that rehab, not rehabilitating her shoulder one day, but rehabilitating her weakness because they had generalized weakness to her, whatever that, laid her up in a bed and didn't move her for 7 days at the previous place. And they had to fight an infection for 17 days while my mother was in there, fight an infection the whole time, to the point that they wrote off almost $500,000 in medical bills at that rehab, at Encompass Rehab, just because they didn't want to admit that they'd given all of her infections to her while she was in that facility. I don't care how old she is or how susceptible she is. You still have to be more protective. And what happened was, when the 2 days prior to that, y'all should have set up the door with the station with the gloves and the things and the mask. But no. We bring my daddy in there and we bring the whole family, kids on the floor doing homework, hanging out with mama, trying to get better. That's how our family rolls. We didn't know. we didn't even know what it was smelling in there. Like we were just like, it didn't want to make her feel bad because we were so happy she was alive, right? That who cared if you did that? We didn't know, but you did, right? So the cath was abnormal and it ended up being a huge infection that we couldn't treat because she had C. diff. So my mother just had to go through the process. In fact, you released her. You did finally release her after 23 days after that surgery. After that surgery with a catheter. Yes, you did. Yes, you did. And for a month, we had to deal with it. I think a month. And it was just a nightmare. And they were the hospital and the urologist and everybody else didn't know enough because y'all didn't tell people enough of anything as they went. And if you read the medical records, as you stated, it all sounds gravy because they knew from the second. And I could see when they stopped documenting. And it is when that 45 minutes that I was waiting in my room that they apologized not telling me about when to get there. That is when they stopped documenting. And they knew they had a hell of a case on their hands that they had. And then they went ahead and brought my mom to the room and told me things were in place when they weren't. And then when that all went to hell in a handbasket and they had code blue, which let's read. Concern. Mother crashed into a code blue due to flash pulmonary edema. Finding partially substantiated. Says your mother was having an expected post-operative course during the night after surgery. No, she didn't. Because if you listen to my videos, you can hear me ask that doctor every single time they were in the room repeatedly. Not ask, tell them about every doctor, if I put them on a stand, would have to say, yes, she mentioned this. And that was when the nurse came in, Ms. Leah Davis came into the room that evening, and my mother finally woke up and was complaining of foot pain. And at that point in time, we pulled her covers back and opened up her foot, and she had on her non-ambulatory, like surgical hose, hospital booty, the thing that pumps and takes your blood pressure from your leg because she'd had a shoulder surgery and the other arm had the IV in it. So they were doing a leg pump on that. And they had the alternating pressure things to keep her from getting blood clots going on each one. And so as they did that, it was, gosh, they did that in post-op. So from 2:20, this was probably like 8:20 by the time the second shift girl got in there. So for 6 hours, it was all pumping and squeezing every 15 minutes. And what happened was the non-slip booty that the hospital lets you wear, the little house shoe socks, became a tourniquet around her ankle because of all of the confusion with the pumping. And it was a level 3. It was deeper. It was outrageous. And I pointed it out to Leah and I said, what is this? And she said, well, it's not always like that. And she was mad. She looked at what happened and she said, oh my God, why do they have these two pumping things going on at the same time? And she angrily Velcro ripped off one of them and left the other one. I don't remember which direction she did that. So that to me right away doesn't say your mother was having an expected post-operative course during the night after surgery. She was not. She also complained that she could not pee and they had to do an IV in the middle of the night that was not documented. We'll go into that. I'll find out like that. The doctor that did it didn't document it. The nurse mentioned it, but the doctor that did it, because the nurse didn't know how to do it, so she had to call in the doctor to help her because she was nervous, and my mom wanted to be catheterized because her stomach hurt, and they ultrasounded and they found enough in her stomach to drain, and I think they drained like 450 cc's. And at that time they woke me up, and this was the night of the surgery. They woke me up and asked if she had heart conditions, and I said no, she doesn't have heart conditions. Didn't ask why, because we were sleeping, and they turned around and they just kept talking. And I assumed it was because that Leah chick was telling this doctor about her foot swelling up. So I wanted them to talk it out. They're the staff, right? Well, they didn't document it. They moved on with their evening. And the next morning, when her surgeon comes in, because he's releasing her, I told him about it too. I told him that her foot blew up, that it was super big and it was super indented and it needed some help and there was something wrong. And we wanted to make sure that everything was okay because that was a lot of fluid. And he said, oh, bye, I'm leaving. Good to see you. And it was 7:15 in the morning. We were not alert. We were not awake. My mother was out of it. I dealt very seriously. He had any kind of decent conversation with her because I was there, and I don't remember him being there for more than 5 minutes. And he was like checking sites. He was checking her wound sites and whatnot. Okay. And then he signed her out. So this says your mother was having an expected post-operative course during the night after surgery. She was seen by her orthopedic surgeon in the morning. Yes. He had reviewed her care and let you know he anticipated discharge later that day. Yes, they were waiting on delayed MRSA results because they hadn't done the swab yet, which he had ordered the day before. We would have been home. We would have been home or on the road when my mother had flash pulmonary edema. It would not have been cool. Okay. At lunch, your mother experienced a dramatic and unexpected change in condition. The event was mischaracterized by responding hospitalist as a code blue. However, all other notes more properly describe the event as a rapid response for required emergent intervention. I need to read that again just because I don't understand what that means. It says, at lunch, your mother experienced a dramatic and unexpected change in condition. The event was mischaracterized by a responding hospitalist as a code blue. So you're saying that Dr. Chmielewski mischaracterized my mother turning blue and not being able to get any air, and then doing an EKG and finding she was having a cardiomyopathy at the same time, but they thought that she was having a heart attack at the same time as a flash pulmonary edema, was mischaracterized by responding hospitalized as a code blue. You think they could have handled it right there on scene? Or do you think I could have handled it if I was in the car with my mom? I could just blown in her mouth and we've been okay. I have a feeling that that's not right. And you mischaracterized this statement is what you did. That hacks me off. It says, however, and this is the fun part, it says, the event was mischaracterized by responding hospitalists as a code blue at the time of. And at the time of the code blue, I stood in that room with my mother around all of these other people. And it says, at lunch, the event was mischaracterized. However, all other notes more properly describe the event as a rapid response for required emergent intervention. I'm going to turn the page on this because I need to read this before I go on. When you went to the nurse's station, which you can read in my blog, they read my blog, the individual you alerted about your mother's distress had informed the RN that she had seen, which she had not, acute respiratory distress, which she had not, because she didn't come in the room. She went straight down the hall slowly while I went back to the room. See, you got it wrong. You need to read it again. I was there. I came out, told her she couldn't breathe. She wouldn't go in, went to the freaking desk 50, 75 feet away. You can see the pictures of how far it is away. And some of them when she's going down the hallway to the ICU. And it says that she had seen acute respiratory stress, and her assigned nurse was busy calling for rapid response alert so that the appropriate treatment team could be dispatched without needless delay. This resulted in respiratory therapy, the hospitalist, and additional critical care nurses at your mother's bedside to provide stabilizing care. Her initial evaluation was consistent with what one could expect if a patient experienced a heart attack, myocardial infarction, or MI. Her breathing symptoms were attributed to flash pulmonary edema. She was properly transferred to the ICU for continued workup and monitoring. At some point in your discussion with floor staff, let's stop. So I'm going to go a sentence back before I turn the page, because I read that and it says, so when I came out of that hallway and then told that nurse, and she went down, and I went back into the room, and my mom's just, she's holding her breath. She's laying in her bed. She's gasping for air. She's staring straight into my eyes and saying, I can't breathe. And I look back down the hallway, and that nurse is just kind of leaning up against the thing. And I'm like, oh no. And I head down there, and that's when I say, is anybody going to help my mom? As loud as I can. And when I do, it alerts more staff, but I get to a point where I can see through these windows, and this woman's just sitting there on the phone, and the other girl says, she's coming. I said, she can't breathe. And we turn around, and everyone runs. All of these people that I just named off, that he named off in this letter to me, that ran to her side, they all collectively at that time decided she was a code blue. There was no mischaracterization. She was going to die if you didn't take care of her right at that point in time. There was about 10 people there. You can go to Paige Pot Pie and look at the time of, I was on the phone in the hallway taking pictures because they made me leave the room. And when they brought me back into the room after the code blue and after the EKG, we all stood in there talking, and I told them about the Narcan, and I told them that the anesthesiologist had told the nurse that evening that she had not put it into the system yet, and she would not see it yet. And so she was going to go back downstairs and she was going to take care of that, but she didn't. And so the course of my mother's treatment from that second on changed forever until today. So you're telling me it was a false blue, code blue. It's a false one. And I've got all of this EKG and all of this stuff showing that the turn of events was the only reason it could have possibly been false is because you ignored it. And it was more neglect than it was false. It was something that could have been prevented. And y'all didn't, because I actually did tell several people before it happened that, hey, we may have a little problem with a little swelling in the feet. But now they were perfect the next morning, right before the flash pulmonary edema happened, and she dropped out. And so you're telling me, and you're giving me this excuse about what that nurse was possibly doing. No, she wasn't doing that. And I know she wasn't, because I was very aware and alert. I can't believe you can't understand how when a person is being like not the one in the trauma, but witnessing the trauma, you kind of pay attention, especially when it's your mama, and you're looking at her dying and she's begging you for the air, and I can't provide her the air. So here we go to the ICU. And that's where we meet, homeboy, Keith, who I have his message on my phone from when they're putting her out of ICU, like 24 hours after they take her to the ICU. And it says, where are we at? It's code blue. Oh, there we are. Concern. ICU asks you not to video record. Substantiated with comment. It was stated that the ICU nurse asked you to stop recording. This is an appropriate request in that there are privacy concerns for other patients as well as for the involved staff members. Undistracted attention of all staff members and physicians must be provided. The concern. Got it. HIPAA's you. HIPAA wasn't me. I was there with my mom. I needed to document what was going on, and I was going to do that because I was in charge of doing that. My family was looking to me to provide them with the answers, and I was there to take my mom home from a shoulder surgery, and we end up in ICU, and she's going to die of a heart attack from as far as I know. She's dying. She's dying. Like I'm in the stairwell having to tell 10 people something's wrong. We can't go home. We're not on our way home. She may not go home. We don't know what happened. And then I go back in the room, tell them what I know, because they're asking me, they're worried. Oh, from that minute, that was the minute that everything changed. And you can read. You said it even. You said it even. It wasn't, however, all other notes more properly describe the event as rapid response. However, all other notes, because from that second on, after he saw what happened and I talked to them, y'all became aware and y'all changed and you left off and you omitted and you went back and even like changed diagnoses. Like it electronically signed in 3 days after this event happened into the time period in which I'm questioning, and you sign in and change the diagnosis to contrast reaction. And that amazes me that you did that, because that was on the third that you're saying she had a contrast reaction. And then on the 4th, she crashes. On the 5th, she has a heart cath. On the 6th, she's back in her room. On the 7th, life was just sucky. On the 8th, they think she has blood clots and is gonna and she's been having arrhythmias and she has lots of pain, and they think she's gonna have like a blood clot in her lung thing. So they have to do more contrast. No questions, no concerns, just contrast her up. That doesn't make sense to me, how you can put all of this on contrast reaction, but yet I don't even see where she got the contrast. If you're see, she didn't get the contrast till, I see. She got contrast at like on 9/3, about 5 o'clock before she came to the room. That was the last thing that happened before she came to the room. That's why they did that, because it was the last thing that happened before the anesthesiologist brought her to the room. She had an x-ray on her shoulder. Damn. All right. Well, see, it's worth walking and talking this out, because I've been in it from the beginning. I was writing on 9/5 in your cafeteria because I knew the way people were walking up to me in white lab jackets that would never have done that before. And even my dad had, when he had open heart surgery, 5 stents put in place. Do you think one person actually comes up to you to talk to you just to see how your mom or daddy are doing? Oh no, but y'all did. Y'all were always checking on us. Where are we from? What are we doing? How you did? CEOs came to my mama's C.diff ridden room just to see how she was doing. Now this just blows my mind. So I'm just, here we are. 6 months later, she's alive. She doesn't have a catheter. We worked that off. We got her bed wounds cleared up. She can walk, which y'all were ready to send us home with a Hoyer lift. And I have the paperwork showing Hoyer lift. You were trying to sell us on that one. This goes on, and you're taking me for a fool. And I'm done with it. I'm over it. Somebody at your establishment, not Kia Parsi, that doesn't know how to spell even her diagnosis, doesn't even know how to spell the thing y'all gave her. And he has the audacity to send me a letter where it's misspelled on every single page, when I have had to do nothing but learn about this the entire time my mother has been suffering with this disease thing that y'all don't even care to learn about. Because you know why? Because it moves the rate of, it expedites your surgery. That'd mess up your post-op. You'd have to have more rooms, more bed, more time. I get it. I get it. You got cutbacks. You got money to nonprofitly make or whatever Common Spirit is doing. Right now, Common Spirit needs to be focused on what's going on at A&M University. Giggle Maggies, I grew up there. I'm from here. We chose there all of the time. Never expected this to happen, but I'm ready. I'm ready to go forth to the news. I'm ready to change some laws. I'm ready to do it all. This is a 50-minute rant, and I'm still only on page 3 of this 6-page letter that y'all sent me. It is amazing that you felt and didn't pay attention to anything. And that's why when I wrote my blog, I wrote it from, because I'm a writer, I wrote it from like, don't go ahead, stay in the moment. Because we want to do chapter 1, chapter 2, chapter 3, chapter 4. So at this point, I hadn't even received any medical records to even write or talk about what I might possibly have found out. I was keeping it within a storyline. And then I get, life happens and it takes me like a month or so to write each one. Plus I have another website. Plus I'm an artist. Plus I have a job. Plus I care for my parents. There's a lot going on. Plus the news and now the pandemic. And here we are. What do we do? Somebody. I already caught it on LinkedIn, on Twitter, on Reddit. I mean, for months. And I'll keep going and I'll keep going and I'll keep going and I'll keep going. And this will be fun. And I'll figure out how to make little blinky lights happen with my video. And we'll just talk about gaslighting, and we'll talk about and break this down word for word and how the hospital system messes you up. And I've got all my pictures, and I just paid for my website for another year. I was really hoping, yeah, it's a shame. It has to be such a dark place. Anyway, giggle Maggies, y'all. I'm out of here.